I'd like to introduce our speaker today. You're really lucky to have a phenomenal lecturer who's going to be teaching this course, Dr. Riley Clark. Dr. Clark is a graduate from Case Western Reserve with a DMD degree. He's an implant-only dentist. He also holds certificates in IV sedation. He's a clinical mentor and lecturer and fellow at the Whitecap Institute, which is a world-renowned implant training facility in Utah. He's adjunct faculty at the University of Utah School of Dentistry. He has a master in implant prosthetics, and he's a board-certified diplomate of the International Congress of Oral Implantologists. But most importantly, Dr. Clark is the go-to expert when it comes to guided implant surgery. Dr. Clark has experience with just about every guided implant system out there on the market. In fact, he's consulted with many of the guided implant companies. He does use the DIOnavi system on a regular basis every day, so you really have a great opportunity, and it's going to be a real treat for you to have such an expert walk you through these DDA sessions today.
Thank you, Matt, for that introduction, and I'm excited to welcome you to the DO Digital Academy Typodont Series. This is going to be a great course where you're going to get familiar with the DIOnavi system, the surgical kits, the workflows, the protocols. I'm really excited for you to participate with this. A little bit of housekeeping things to get started. There are two important components to this DDA series. The first is going to be what I call the Typodont box. In this Typodont box, you have your Typodont, your simulation guides and implants, your abutments. We review this box in the later part of this course, but this box is going to be paramount because we're going to use this for all of our surgical simulations. So that's an important part of this series. If you don't have this, you can follow along. If you have it, then you can work right alongside with us as we progress through this DDA series. The second real important component of this course are going to be all of the different surgical kits that DIOnavi has. These are going to be used with the Typodont simulated surgeries, and in conjunction with these together, we're going to be able to have a great, vast perspective of the DIOnavi workflow, protocol, and the really unique features of their system. Excited that you're able to join us for this DDA session. Let's go ahead and jump right in. So first topic, DIOnavi technology introduction and clinical value. I'm excited to talk about this with you as I've had a lot of experience working with other dental implant companies, dental implant guide companies, different laboratories, and I've seen what's out there, which makes what I'm about to share with you even more meaningful to me and in my practice because it really is a level above the competition. Let's go ahead and get started. I want to play this quick little video for you to get started, okay? Here's a fun little video. I'd like to go through it. It highlights some of these technology pieces that really sets DIOnavi apart. So here you're seeing an edentulous spot in the mandible. We're always going to start with a prosthetic tooth first. So a tooth is going to be placed in the virtual world, and we're going to make sure it is in the ideal geometry to match the final restoration. From there, the implant is designed with respect to the anatomical structures around that area. And then, of course, complementing the prosthetic plan of the tooth. Here you're seeing the use of a special abutment called an anatomical abutment. That's going to be key in some of the workflows of the DIOnavi system. So here's the process, the implant coming right off the 3D printer. This 3D printer is specifically designed from DIOnavi to seamlessly work within their workflow. Their implant surface, the most contemporary implant surface on the market. And now you're going to see that implant be supercharged, so to speak, with the chair-side UV activation process. This is going to enable the implant to be even more hydrophilic, lending itself to faster healing time and a stronger implant at the end of the day. Here's the anatomical abutment you're seeing, custom fit for each area based on analysis of hundreds and hundreds of formerly made custom abutments. Now you're going to see the many clinical situations that the DIOnavi system is complementary to. Anywhere from edentulous areas, anterior aesthetic cases, posterior sinus cases, you name it, DIOnavi has a great solution for it. All right, moving on, I'd like to focus in now on that UV activation for a little bit. Through this process of UV activation, the dental implant surface is removed of debris or hydrocarbons that can build up on the surface of the implant, producing a more hydrophilic implant. That's what you're seeing right here, is that process through UV activation, creating a more pure, activated surface of the implant. Here you're seeing a competition test, if you will, between two other hydrophilic implant surfaces and the DIO UV surface. Amazing to see that hydrophilic property with a chair side activation. Really, really impressive. That UV implant I'm seeing routinely placed, and 4 to 6 weeks later, ISQ readings well above 70. That's really, really exciting to offer that to our patients. They no longer have to wait as long as they've been used to, and then we can get to the restorative procedures even sooner. So win-win for everyone. This really is a unique thing about DIOnavi. Their guides fit remarkable. Like I said, I had worked with lots and lots of different implant companies, different guide companies and labs, and I've never seen a guide fit with the precision and the accuracy of the DIOnavi system. It's a wonderful fitting guide to see it perfectly marry itself with the anatomical structure of our clinical crowns or our soft tissue guides. It's a very, very well-fitting guide. End of the day, we can thoughtfully plan our implants, we can tweak it all we want in the virtual world, but if that physical guide does not seat properly with precision, all of that thoughtful planning in the virtual world will not translate to any type of clinical benefit. And so I really appreciate a wonderful fitting guide, really, really important to a final outcome that we're really proud of. Another unique thing with DIOnavi, when they send my surgical reports with me, I get a structure map just like this that shows me how dense the bone is going to be around the body of my implant. If I'm preparing for my drilling protocol, whether I want to undersize the osteotomy or make it a true size, if I'm considering primary stability for immediate loading, a topography map like this helps me understand what type of density we're going to be experiencing while drilling. So through a Hounsfield unit measurement in the software, we can go before surgery even happens and make some clinical plans based on what the bone density is going to be like. I appreciate that extra boost of confidence to understand what the situation is going to look like clinically. As you know, bone quality makes such a difference in our implant cases when we talk about loading, primary stability. This takes a little bit of the mystique off of that analysis of what is it going to be like. Another thing I really like with DIOnavi is their drilling protocols. They'll show up on a sheet just like this, and this sheet just makes it seamless and easy to understand what the protocol is. Not in words, but in pictures. Anyone can read it, anyone can understand it. It makes it even easier for me as a clinician to be there and to see exactly what the drilling protocol is going to look like. As you can see at the bottom, there's a D3 step where you would end after density 3, and then there's a D2 or D1 step, giving you some insight to what you might undersize your osteotomy as in preparation for primary stability. I like this. It's thoughtful, it's clever, it's streamlined, it's easy, it's convenient. That might be a theme of just what the DIOnavi system is, and this little picture form of their drilling protocol kind of epitomizes that exactness of what DIOnavi can do for you. Makes it easy and simple for you, so you don't need to think any harder than you have to. Last thing I want to mention when we talk about this is this anatomical abutment. These anatomical abutments, again, are designed from analyzing hundreds and hundreds of custom abutments, and they came up with some unique geometries and those geometries are very complementary to soft tissue contours in the mouth. So you don't need to pay the price for a big old custom abutment, but you still get the benefit of an anatomical abutment that can go in, be very thoughtfully crafted relative to the soft tissues, could theoretically stay in the mouth the entire time, never needing to be removed, because it also doubles as a scan body. So this can be scanned in the mouth, and then from that impression, a final prosthetic can be planned. I appreciate the thoughtfulness with soft tissue. Soft tissue, we know that if we can put an abutment in early and leave it undisrupted, then with that, we will have a long-term soft tissue connection around these titanium surfaces. And so I love the idea of an anatomical abutment going in the day of surgery, staying in because it does not need to be removed for impression taking, and then being our final abutment if that's what you choose. It's a really clever abutment. It's a little more economical. It's very thoughtful to soft tissue. I think it's a very, very clever idea. They come in a variety of sizes, as I mentioned. You're seeing some of the size options right there. Based on anatomy, based on size and shape of the surrounding teeth and tissues, you'd select the right one from that. It's all done in the digital world, though, for you. So in the digital world, they can measure, look at that, hand select the right one for you. Just a couple of more slides I have here. This is a really cool case I did just a couple of weeks ago. What I love with this slide here is it really highlights, in essence, what the DIOnavi system does for me, for my practice, and my patients. This patient came in under 15 minutes. All of those implants went in with the guide, with surgical precision. The patient left thinking, have we even started? I love a system that lets the patient feel like they're a king or queen. I love a system that lets me as the clinician feel like I'm doing a great job for my patient, saving time, saving stress. And to get 3 implants just like that, parallel, thoughtfully planned, relative to our prosthetics in a way that is efficient, good use of time, everyone is winning. My patients appreciate it, my clinic appreciates it, I certainly appreciate it as the clinician. I think that tells a big story right there. So when we talk about this technology and how does it really benefit us as providers, I think that x-ray tells the whole story right there. Maybe one last little thought. What I love also with DIOnavi, it's this idea of a case in a box. And so one case gets sent to me, I open it up, it has my implants, my guides, my healing abutment, or my custom abutment, or my anatomical abutment, with a prosthetic crown, with my drilling protocol, all in one box. In terms of organizing our implant cases, coordinating with this lab, or this manufacturer, this really streamlines it. There's only one place, DIOnavi, I talk to them, and they get the whole thing from A to Z figured out for me. And it just makes it a lot easier for organizing our cases. I really appreciate what the case in the box can do. And so those are some of the things that I think are highlights of the DIOnavi system, how the technology benefits you, me, and the patient. I hope you enjoyed that. Let's keep moving forward. So with that said, we're going to jump in and we're going to introduce all of these components really specifically so you're very familiar with them before we actually start doing our simulated surgeries. Now I'd like to introduce you to the DDA box. I'd like to show you the components that are inside. So the first thing you're going to notice is this Typodont box here. Let's go ahead and open this up and take a look. This Typodont is where most of the simulations are going to take place. So if you look at it here, we have an edentulous arch on the mandible. The upper, we have an anterior edentulous space, a single tooth on the upper right, and then upper left is a multiple tooth edentulous area. Both of these are actually going to be sinus grafting procedures. This will be an anterior bridge case, and this will be a full arch or edentulous case, and this will be used in conjunction with all the components that are in here. So this is your Typodont. We're going to want to make sure we do a good job with this. This can be used great for patient education when you're done. If it looks really good when you're done and you're proud of it, then throw this in your consult room and this can be shown off with patients to help them better understand the implant treatment that you might offer in your practice. So I'm going to set this aside now. So now let's take a look at all these different cases that are in the actual box. I'm going to grab these and I'm going to set these out and we'll take a look at these. and I'll show you what they're for. So, here we have a hands-on block case, and the actual guide that you're going to use is in this little package. This is case number 3, 4, 5, and 6. For this DDA series, we're going to start on case 3. So if you don't see a case 1 or 2, don't worry, your box is exactly how it should be. The last thing I'll point out is it does have a little component organizer. This has different abutments, screws, things like that that we will use. Essentially, each one of these is a DDA series where we will introduce the DDA protocol or simulation based on the different surgical scenario that we have here. So each one of these represents a different scenario. It'll give us an opportunity to better understand the kits, the drills, exactly how the system works. So this is what should be in the kit, your Typodont. You should have the bone block case and then case 3 through 6 with your little organizer with abutments and screws. Here's the first surgical kit I would like to introduce in some detail. This is the DIOnavi Master Kit. This kit is probably going to be used most common, and so it's important we understand this kit. What I'd like to do is unbox it, introduce it to you kind of in a broad perspective, and then when we're actually doing the simulations, we'll talk in more detail specific uses of the drills and things like that. With that said, let's open this thing up. There's a little tab here I've already ripped off because it takes a second. After that, you're just going to open the box like so, and the first thing that you're going to see is this little card. This card provides a little bit of oversight of what is in the kit, and all of the components and their product numbers are listed here. These are great to keep in your sterilization room so that when kits are being cleaned or put back together, there's a reference for them. So don't throw this away. This is a helpful reference for you. I'm going to set that to the side, lift this kit up, and it has, of course, a little protective wrap. That slides off. And then here is the DIOnavi Master Kit. Let's jump into this kit just a little bit. You lift up both sides, and then the cage comes right off the top. And then here are all the components, a lot of components. And I can appreciate if you're a little intimidated looking at this for the first time. I'm going to broadly describe what different areas of this kit consist of and what their purpose is. And then, like I said, as we get to the simulations, you'll see in more detail exactly what their purpose is. So the bottom left of this kit is what I would call the piloting phase. This is where you start your initial drilling phase. There are drill tubes here, tissue punch, bone flattening drill, and then short 5mm drills. This is basically your piloting phase. After that, it breaks up into these columns, which represent different diameter of drills, indicated here at the very bottom. So for example, a 2.0 drill is right here. Length increases as you go up the column. As you go over the row, come to 4.3 diameter drill, and again, length increases as you go up. At the very top of the kit are your profile drills. These drills are used in conjunction with your end cutting drills to help shape your osteotomy. We'll talk exactly how these are used a little bit. Essentially, this is the cutting part of your surgical kit. This is how the osteotomy will be shaped, how it will be formed, is using all of these drills right here. On the far right side are the parts needed to place the implant. So up at the top is what they call a connector extension. They have them in a handpiece attachment and a torque wrench attachment, and then implant connectors. The implant connector, there's a narrow platform size and a regular platform size. They come in a stopper and a non-stopper. We'll review what that is in our surgery simulation. The bottom right is our abutment profile drills. This is the final drill that you may choose to use in your protocol to help shape the bone a little bit more to seat some type of abutment that you've ordered. On the far left top area is the screwdriver area, and this has a few different drivers, hex drivers, some that can go in your handpiece, some that can be used with a ratchet or with your hand. This is simply to tighten different components into the implant body. The last thing I want to point out with the kit, if you grab these little tabs on the side and lift, there's a lower portion that has a nice little component dish. I like to keep small parts and pieces in here, or if you want to put drills after they're used in here, whatever you'd like. But this is a great surgical dish that you'd like to utilize during your surgery. And then lastly is your torque wrench is down here as well with your wire gauge. So that is the DIOnavi Master Kit. Now I'd like to introduce the DIOnavi Narrow Kit. This is the kit that you will use to place the narrow platform implant, which again is the 3.0 and 3.3 diameter implant. Let's go ahead and take a look. You're going to open it up. It's going to have this little carton that holds it in here. You'll flip these two edges up and then push the other side, and it will slide right out. We will remove the plastic covering, and then again lift on the sides, and the cassette opens right up. This again is called the Narrow Surgical Kit. This is used for the narrow platform implant. Similar to the other kits, the lower left is intended for your piloting phases, widening your osteotomy. There are again profile drills at the very top, and then on the far right we have screwdrivers. We have the connector extension and the implant connectors, and then again your abutment profile. So very similar to your DIOnavi Master Kit, just fewer drills, and they're in a little different position, but similar components because it's going to do the same job. It's going to help you place the implant, just a smaller diameter size. And so if you'll notice, the drill diameters are a lot skinnier to correspond with the skinnier diameter implants that they're intended to place. If you lift this and move it, you again have a surgical component dish, and then you have your torque wrench as well. That is the DIOnavi Narrow Kit. Now I'd like to introduce the DIOnavi Sinus Lift Kit. Very exciting kit that allows you to do sinus procedures all through a surgical guide. Let's take a look. So it's wrapped again in this little protective container. You're going to pop these corners like so, and then you can pull the kit right out. I hear a few parts that are a little loose in there. We'll see what happened in transit. We're going to pull the kit out, and then we're going to take a look at the different components. Okay, I got a couple of pieces here that ran into a couple of funny places. I'm going to put them back where they go. This is the sinus lift kit. Now this kit is used in conjunction with your DIOnavi Master Kit. So don't make the mistake of thinking that if you're doing a sinus augmentation with an implant, you only need the sinus kit. You will need the DIOnavi Master Kit and this kit. They work in conjunction with each other, okay? This kit is really simple. The top left are drill stoppers for your pilot drill, meaning your 2.0 diameter drill. So these little stoppers, they're color-coded, actually slide onto the drills of your DIOnavi Master Kit. After you get done with the piloting phase, you will use these different wider stoppers that also go onto the drills of your DIOnavi Master Kit. These stoppers basically help you stop at a certain length determined in planning software to help you engage the sinus at the appropriate protocol. And so you have stoppers and more stoppers. Their corresponding length is all written down here, and they're color coded. You then have 3 sinus drills. These are the only drills within the sinus kit. And these are used at a special time during the drilling protocol that we'll review in our different simulations. But these are the sinus drills. They come in a 17, an 18, and a 19 millimeter length. They then have a bone condenser or bone packer. This is really nice because it can receive the different stoppers, and that will provide some safety as you're packing bone into the sinus. Which stopper you use is specific, obviously, for each case, and we'll explain in our simulation how you know which stopper to use. There's also what they call a square wrench, which is used during the hydrostatic pressure lift. And so this is used in conjunction with the membrane lifter and the membrane lifter will fit into this, and it will allow you to hold it gracefully in the mouth when you do your hydrostatic lift. Speaking of the membrane lifter, here it is. It fits nicely into this, and then the handle allows you to easily hold it. Without this handle, you would have to grab it like so, and that just gets a little bit cumbersome when working in the oral cavity. So this works in conjunction with this. And then lastly, we have a component dish. This allows you to put different parts and pieces in here, bone graft material, whatever you want, but these are always out on our surgical table. That is the DIOnavi sinus lift kit. Okay, the next kit I'd like to introduce is the DIOnavi Special Kit. Sometimes this is referred to as the edentulous kit, the fix pin kit. Those all kind of mean the same thing. I refer to it as the Special Kit. That is the proper name for the kit. But this is the kit that you're going to use for sure with your edentulous cases, but it also has a few unique drills that are used under very specific criteria or circumstances, and that's why it's called the Special Kit. Let's take a look inside. Like all of the other kits, it's wrapped in this little piece right here. We're going to flip the tabs up, and we're going to push the kit out. We're going to take it out of its wrapper, and then we'll take a look inside. So again, you're going to lift the tabs on the side, and now we've got the kit right here. So there's a few things going on in this kit, and again, that's why it's called the Special Kit. Let's go through them real quick. At the very bottom are your 15 millimeter length drills. If you noticed, in the DIOnavi Master Kit, the drill length only goes to 13. If that bothers you, you can order another set of 15 drills or steal them from this kit and put them in your Master Kit. However, they keep the 15 millimeter drills in the Special Kit because they're probably not used that often. If you find that you are using them a lot, you might consider moving them into your Master Kit. Otherwise, don't forget the 15 drills are here in the Special Kit. They go from 2.0 diameter all the way up to 4.3 diameter, all at the 15 millimeter length. So those are your long drills. At the top left is the anchor system for your edentulous guides. So if your edentulous guide has horizontal anchor pins to help stabilize the guide, this component right here is going to be used to help fasten that. You have a drill that will drill into the bone, creating a site preparation for the actual anchor screws. Now the anchor screws come in a short and a long. The short is typically used for the mandible, and the long is typically used for the maxilla. But if you notice, they only give you one drill, but they also give you a stopper. So the drill without a stopper works for your long anchor screw, and then the drill with the stopper is intended for the short. Then there's also a driver. This goes into your connector extension that is found in your DIOnavi Master Kit. So again, this is used in conjunction with your Master Kit. That's the driver that the anchor pins are placed with. Okay? So that is the anchor system. I'm now going to jump over to the far right. These are called guide fix pins. And the guide fix pins are a clever way to provide additional stability to your surgical guide. So after you have placed an implant, if you would like the guide to be even more stabilized, you can take a fix pin or a guide fix pin, and you can actually screw it into the implant through the guide sleeve, and this will help hold the guide down, putting apical pressure on the guide, helping seat it properly. There are 3 colors. The blue is for your offset 9, the gold is for offset 10.5, and the pink is for your offset 12. If you're not familiar with offset yet, don't worry, we're going to review that in a video coming up. But the point is, at different offsets, you would have to use a different pin. The classic example when these are used is typically an edentulous guide. After an implant or 2 is placed, by screwing these into the implants, it provides more stability. They could also be used for a tooth-borne guide as well. Just at those guides typically don't require additional stabilization. So that is a stabilizing tool for your guides. Now we've got 2 more columns here. One is the guide pin. These are simply paralleling pins. So after you have drilled a pilot hole, if you wanted to put a pin in through the surgical guide and take an x-ray, then this is going to fit gracefully into the surgical guide sleeve. So these are basically fancy guided surgery paralleling pins, and those are in your special kit. The last drill here is what they call the point straight drill, and it has a really aggressive end cutting surface, and this is used when you're cutting on very angled surfaces. And that angled surface can sometimes cause slippage to happen as you're trying to drill, and the aggressive pattern at the apical end of this drill allows it to grab the bone a little bit more aggressively. To help you understand that straight point drill a little bit better, here's a little diagram showing exactly what it's used for. So if you look at a normal end cutting drill on a sloped surface like this, it has a tendency to fall down the slope. This drill, because of its very aggressive teeth at the end of its drilling surface, grab the bone and allow it to drill more straight into that sloped surface. There is an additional key that is used because the diameter of this drill is 2.5 millimeters, so it will not fit in your normal tube or key found in the guide system. So again, looking at our kit, there is a tube that is 2.5. This is used exactly for the point straight drill. And there's a short and a long, just depending on how far apical you're trying to drill. At the bottom of this, there's nothing in here. So if this is empty, don't worry, that's the way it's supposed to be. But this right here is your DIOnavi special kit. The next kit I would like to introduce to you is the DIOnavi wide kit. This is used for implants that have a diameter greater than 5 millimeters. Let's take a look inside. The first thing you'll notice is this laminated sheet providing an overview of the different components of the surgical guide kit, a little information about the kit, and perhaps most useful, it has a component list with their SKU or model number should you ever need to order anything because something goes missing or it's overused. So you're going to want to hang on to this. This is important. We're going to lift the kit out, and then we're going to click these tabs open and then pull it right out of that little packaging. And then we're going to pull it out of the plastic wrap. So here is your DIOnavi wide surgical kit. Let's take a look at it. This kit ideally can be used with your DIOnavi master kit using some of those drills, but it does have narrow drills. You could theoretically go only to this kit and drill a wide body implant. I typically find I'm using it in conjunction with my DIOnavi master kit because I'm probably doing multiple implants. I have both out anyways. This kit is a little confusing at first. It has a drill tube on the far right. However, the drill tube is not needed for any of the drills within this kit. If you wanted to use your DIOnavi master kit and drill in a wide surgical guide sleeve, that's when the tube is used. So this could insert into your wide surgical guide sleeve, and then you could use your DIOnavi master kit with this, because it basically reduces the diameter to the size of sleeve found in a regular surgical guide sleeve. Otherwise, all of these drills are going to fit exactly into the surgical guide sleeve for the wide, which is indicated by the color green. So you have your piloting phase on this lower left side, tissue punch, bone flattening, your short 5 millimeter drill, and even a 2 millimeter drill to get started. And then they incrementally go up in length, and then this is what's interesting with the kit. There's a 3.2 by 7, a 3.8 diameter by 7, and a 4.3 by 7. So you're going to widen the osteotomy basically 7 millimeters of depth, and then you have all of the normal size increments in the wide body sizing. So a 4.8, a 5.0, and a 5.5. So this is a little bit different format than the other kits. If you just take a look at it, you'll notice it's pretty intuitive how the lines work, meaning you follow the black line up to your diameter, and then you have your normal drilling protocol right here. This kit's going to make a lot more sense when we review it with the surgical guide protocol right in front of us. The point is, piloting here, widening the osteotomy here, final osteotomy prep here, and then we use a tap drill instead of a profile drill on the wide body implant. So you actually have taps here. There are profiles, but tap drills are also included in your DIOnavi wide kit. You then have your connector extensions that work with your implant connector to put your implant in, and of course your abutment profiles to widen the osteotomy to receive an abutment. Down underneath, you have a torque wrench, and then you have your implant component dish that can be used as well. That is the DIOnavi wide body kit.